Hello, I am Dr. Enam Abood, and I am here today to talk to you about high blood pressure, and that is called in medical jargon hypertension. So it's high blood pressure. Um, what is blood pressure? Many of my patients, when I talk about blood pressure, they just look at me like puzzled. What is blood pressure? See, we have a network of arteries. These are the tubes, elastic tubes made out of muscle, where the heart pushes the blood to go through them and reaches every single organ and every single cell we have in our body. So those tubes, imagine you have a hose and then you run water into the hose. We create a pressure inside the hose. It is the water pressure. So that's exactly the same when the heart pumps at quite a force, because you try checking your pulse, let's say here in the neck, and at the same time, if you can reach or do some acrobats, reach your foot, you will see that you can feel a pulse in the neck and in the foot, almost with just a fraction of a second. It's incredible, really. So that force of the flow of blood creates the pressure, and this is called the blood pressure. There are two readings. Any of you who've had a blood pressure reading, like is average for the population of 120/80. So what are these two readings? When the heart pumps, that's the pressure created. When the heart relaxes between pumps, of course, the arteries are still full of blood and there is also pressure there. So this is then the 80. Usually it is acceptable in this country, because different countries have different measures. America have lower acceptable normal. Here we say 140/90 is the upper limit of a normal blood pressure. In my opinion, I think it's high, especially in young people. But if somebody is in their 70s and 80s, then that is different. So we accept that. We do in the clinic different general checkups, well-man, well-woman checkups. I also make sure any patient I have, as soon as they are on my examination couch, for whatever reason they are here, I always check their blood pressure, because I've been finding frequently that people's blood pressures are higher than they should be for their age in particular, and they are not aware of it. There are some symptoms of high blood pressure which I really need you to be aware of. Headaches. Somebody has a headache. This is very common symptom of blood pressure, but what we usually do, most people do, we just take an ibuprofen or a paracetamol, make the headache get better, but never ask ourselves, what is the reason? Why am I having headache? It could be the blood pressure is high, but it could be my eyes are not doing well, and it could be other reasons. So please, symptoms like that cannot be ignored. Absolutely. If it happens on occasion, that's different. But if it is consistent and is happening every day, sometimes it gets worse with stress. We can't live without stress. I totally know that and I'm aware of that. But there are different ways of dealing with stress. Stress is one of the common reasons of raising the blood pressure. Now, why would it do that? Because when we are stressed, our brain produces stress hormones. Adrenalines, noradrenalines, they actually constrict, they make our arteries smaller girth, which means the pressure will increase because the heart has to push against a narrow artery now. So this is how stress can increase the blood pressure. The other symptom of blood pressure, sometimes it happens, and I have seen it over many years, some patients, bleeding in the white of the eye, in the sclera. So some blood vessels might burst. It's simply because the blood pressure is high. Why blood pressure is important? Because if we don't manage, don't treat high blood pressure, don't prevent ourselves from having a high blood pressure, the heart will become tired. Imagine It's a muscle, it's a mechanical pump. It pushes against high resistance many times a minute, let's say between 60 to 90 times. That's normal average for the pulse. And imagine like you have to push, and you push is just like you are carrying weight in your arm and then in your hand, and then you're exercising your biceps. It will get huge if you do as much as the heart does. So when the blood pressure is high, it can cause heart failure. It can cause stroke. Stroke means the smaller blood vessels in the brain will burst, and that could be fatal or causes massive problems, paralysis, and so forth. So this cannot be ignored. What can we do to prevent it? Healthy eating. Salt. You know, salt is the number one culprit in the increase of blood pressure amongst any other additive in the cooking. And it's unfortunate common habit where people even like sit at home or eat outside, the first thing they do before they even taste their food is to shake some salt on top. You haven't even tasted it. You know, a while ago, a few years ago, they started a law in New York to prosecute restaurants whose salt content in the food was higher than was expected or anticipated. I don't really think we need to go that far, but we really need to start from simple measures. Don't put salt on the food until you taste it, and perhaps you can add herbs and just change the taste. We get used to having lower salt levels in our food. That's really very important. Alcohol increases blood pressure. It's a direct link between the amount of alcohol consumed and the blood pressure level. So that is really very important, particularly in older people. And when I say older, I mean like after 40s. So we need to be aware of that. Having excess weight, being overweight or clinically obese does play a major role in blood pressure. Not everybody who's overweight has high blood pressure, of course not. But it's not just the weight by itself, it's really a predisposing factor. But people who are overweight, they exercise, they eat healthy, they still protect their blood pressure. It's simply not the weight itself, but how much fat is deposited in the viscera, meaning inside, surrounding our organs, in the small intestine. That's really what can cause restriction to the blood flow in that area, and that can raise the blood pressure. So if you ever have any of the symptoms that I've mentioned, the headache is the commonest one, feeling tired, sometimes people might have throbbing sensation in the head, or they feel hot and flushed with no real reason, then please make sure that your blood pressure is checked. You can actually get a very simple, cheap monitor from any pharmacy or Amazon and check it at home randomly. But if you see that you have those symptoms, please seek help. Go to see your GP. Make sure that you are looked after, because prevention is the key. We don't need to fall off a cliff and mend broken heads and broken bones. We can always erect a fence.